All right, guys, so now we're going to talk about cleaning inside the trachea. And this is kind of an interesting one because you'll meet some people that have long-term trachs in, and so they, especially if they're home, they're not going to want the cost of the disposable pieces that can be in them. So they might have these long-term ones, which is what this is. And you can see that we're not going to throw that away because it's very specific to this trach. So we're going to clean that out. But more commonly now what we're seeing is we're seeing disposable ones. So you see with this trachea, it has this clear plastic and then they have little tabs on each side. And you're going to pull this out, maybe, and you're going to throw this away and get a new one and clean it. I know at Madonna, I believe respiratory therapy does this at night, so you probably won't see it unless a patient is all of a sudden needing it. But more commonly with trachs now that we're seeing this. But that doesn't mean we don't have patients that have had trachs for 15 years and they'll have this one. So that's why we're going to teach you the procedure of how to clean the inner cannula and the trach. So first what you're going to get is you're going to get a kit, and these kits are sterile, so we want to make sure that we're paying attention to our sterile fields and sterile process, okay? So I'm going to open this kit. I'm going to tell my patient, hey, I'm coming in, we're going to do some trachs, clean out your trach and get you ready for the day or whatever. So we're going to open it. It's got a little drape in it. I'm going to use my drape, kind of put it across his chest, just to kind of help catch some of the drips and that kind of stuff. You can see I have sterile gloves in here, so I'm going to pull out my sterile gloves and put them on. Make sure my sterile feels good. Oop, wrong way. It happens. Ooh, and these look like size huge gloves. Yep. So that is for somebody with some really big paws. All right, so my hands are sterile. All right, now in this kit you've got hydrogen peroxide. Oh, this has two of them, but you only really need one. It has hydrogen peroxide and then a saline or a water solution. And you're gonna pour the water into one and then into the other, and then hydrogen peroxide just into one to make a half and half solution. All right, and once those are poured, then you can throw these away. So we're gonna toss these over here like we poured them and throw them away, okay? Then what we have in here is we have a bunch of little tools. So you got like a little bristly scrub brush that maybe you've seen with bottles. This kit comes with some drainage sponges and some other of those. We've got Q-tips for cleaning, and then last but not least, we have a nice little pipe cleaner if you get somebody with a really tiny trach, like those little babies and stuff like that. So what we're gonna do is, again, you're gonna figure out what's your clean hand and what's your sterile hand, all right? I'm gonna come over here. So this is gonna be my dirty hand, right? I'm gonna pull this out as best I can to get it out. And then I'm gonna go in here and I'm gonna use my little scrub brush. I'm gonna pour this, get this into my hydrogen peroxide and water mix, okay? And then kind of clean. And this is where you might see like they might have some kind of crusty boogers kind of in here. I mean, that's kind of what we're doing, is cleaning that out. Kind of go in here. Might have to do it a couple times. And then once you're done with that, you're gonna use the rinse water and rinse it out and get it out. I like to do a couple little shakes to get those drips out of there, because otherwise you're putting that water down into their lungs and they might cough at you a little bit more. All right, and then we're gonna put this back in. And sometimes it takes a little wiggle and finesse, and then you'll kind of click it back in or however it goes back in. The other thing we can do now is we can combine some of our skills that we've already seen videos on, and we can use the Q-tips, because now both hands are dirty or kind of clean but not sterile, and we can use some of that hydrogen peroxide water to clean around there and combine all of our cares into one seamless care for our patient. Please let us know if you have any questions, and we'll see you in lab.